Just over 60 miles north of the capital city of Nairobi in Kenya sits Naivasha. The beauty of this region's landscape, where thousands upon thousands of exquisite roses are grown for export around the world, belies the tragic reality of the many women who work in the area's thriving horticulture industry. It is behind this breathtaking backdrop that health care for pregnant women and their children is insufficient. While the number of women who work in this region has increased, even the most basic health care for these women has not kept pace. The chilling effect of this health care crisis is felt most by pregnant women and their children. It is a well-known fact that insufficient maternal care during pregnancy and delivery is responsible for a staggering number of maternal and neonatal deaths. The clinics are overcrowded, and mothers wait in long lines to be seen. The nurses teach nutrition, but mothers do not have the money for prenatal vitamins and healthy food. This situation is especially heartbreaking in light of the fact that the healthcare providers in Naivasha want desperately to give women and babies the kind of health care they deserve. They simply are unable to do so.
Okay, today we have 45 children in the pediatric wards, and usually sometimes we find that the ward is so packed because it goes even up to 80 when you have many children.
We also don't have a burns unit for this place. We see them, we've actually given one of the cubes for the burns patient in the general ward to burns patients. But sometimes they have to share because the capacity is quite high, and that doesn't do well for the infection control. But we still do our best.
They lack everything, from basic necessities such as beds and blankets to more sophisticated equipment. A recent shipment of equipment donated by healthcare professionals in the Omaha area included an ultrasound, infant warmer, and fetal monitor, the first to be used in this hospital. But they need more. The Naivasha District Hospital maternity wing clearly illustrates how far removed the birth experience for these women is from women in America. In Naivasha, giving birth is crowded, risky, and impersonal. The women all labor and deliver together in one large room without the support of family or friends. After delivery, women here can expect to share a single bed with another mother and her baby. The risk of being exposed to a wide range of infectious diseases is high. Privacy is unheard of. Spouses and families are not allowed to attend the birth or support the mother because of overcrowding. Any clothes, blankets, diapers, or personal items needed for mother or baby must be brought to the hospital by the mother. A worse fate awaits mothers and babies who are at high risk of complications. Only one fetal monitor is available to accommodate 20 births per day. The small, ill-equipped nursery has only 8 wire cribs reserved for preterm, sick, or abandoned babies. The only method to provide warmth to these babies is a small heater on the floor or blankets piled on top of the infants. The nurses know how to improvise, but they need help. The Naivasha Women's Healthcare Center, designed with the generous assistance of U.S. medical professionals and local architects, will drastically improve women's health care throughout the region. It will save the lives of countless mothers and children. It will provide the safe, family-centered experience these women so deserve. A new day is dawning for the women and children of Naivasha. The Naivasha Women's Healthcare Center will allow women to labor, deliver, and recover in a semi-private suite with their family in attendance. They will stay in this suite with their baby until discharge. A high-risk nursery will be available for premature or sick babies. Equipment such as infant warmers will be available to all at-risk newborns. More high-risk pregnancies will be detected in outpatient clinics. Ultrasounds and fetal monitoring will be available to all mothers to ensure a more positive outcome for mother and baby. 2 surgical suites will be available for emergency cesarean sections. The clinic will counsel women on infertility and family planning. HIV and AIDS education will take place. Cancer screening will be available. Colonoscopies and mammography will be available for the first time in this community. What has been available for decades in the United States will finally be available to the women and children of Naivasha. What is expected by us will be cherished by them. Finally, the women and children of Naivasha will have the promise of a healthier, happier life. Won't you please help us build this clinic? The Friends of Naivasha Hospital in Omaha, Nebraska has exported a great deal of necessary equipment, including hospital and birthing beds, operating tables and surgical lights, fetal and cardiac monitors, and ultrasound machines. Construction has begun on a 48-bed women's hospital with 12 neonatal beds. However, the need remains great. With your support, the Naivasha Women's Healthcare Center can make all things possible for our women, our children, our future.